Imagine doing something millions of men do quietly and discovering it may influence your prostate health in ways no one ever clearly explained to you before. Now let me ask you something important, and I want you to answer honestly in the comments below. Have you ever wondered whether masturbating every day helps your prostate, harms it, or does absolutely nothing at all? I'm speaking to you as a doctor who has spent years answering uncomfortable questions behind closed doors, and I want you to know this is a safe, judgment-free conversation. Many men worry in silence, and that silence often creates more stress than the habit itself. Stress, by the way, affects your prostate more than most people realize. So let's clear the fog together, calmly and truthfully. When a man ejaculates, the prostate contracts and releases fluid that's been stored inside it. This is a normal biological process, not a moral issue or a medical emergency. In simple terms, the prostate is doing the job it was designed to do. Regular use does not automatically mean damage. Here's something that surprises many of my patients. Several large observational studies have found that regular ejaculation is associated with a lower risk of certain prostate problems later in life. That doesn't mean it's a cure or a guarantee, but it does suggest that stagnation may not be ideal. The prostate, like many glands, benefits from regular circulation and movement. Now, I want to slow this down for a moment. Masturbating every day does not overwork the prostate in healthy men. Your body constantly produces prostatic fluid, whether you ejaculate or not. Ejaculation is simply one way that fluid exits the system. Some men worry that daily masturbation causes inflammation or enlargement of the prostate. In reality, benign prostatic enlargement is driven mainly by age, hormones, genetics, and overall metabolic health. Masturbation has not been shown to cause benign prostatic hyperplasia. If it did, we'd see clear patterns by now, and we don't. That said, your body always speaks to you, and listening matters. If daily masturbation is followed by pain, burning, or pelvic discomfort, that's not something to ignore. Those symptoms are more often related to pelvic floor tension, infection, or prostatitis, not the frequency itself. Frequency just happens to be blamed. Let me share something I've seen many times in clinic. A man comes in convinced he's damaged himself by masturbating too often. After a proper exam, we find stress, dehydration, poor sleep, and long hours sitting are the real culprits. Once those are addressed, the fear disappears, and so do many symptoms. Now let me move you gently into the next part of this conversation. What happens hormonally and neurologically when masturbation becomes daily? This is where balance, not fear, becomes important. Ejaculation temporarily lowers sexual tension and can reduce stress hormones like cortisol. That's one reason many men feel relaxed afterward. Lower stress can indirectly benefit prostate health by calming inflammatory pathways in the body. Again, indirect, but real. However, if masturbation becomes compulsive or tied to anxiety relief only, the issue isn't the prostate. The issue is the nervous system. When your brain relies on one behavior to regulate stress, the body can stay in a loop of tension and release. That loop doesn't damage the prostate directly, but it can affect sleep, focus, and motivation. I often tell men this. The prostate doesn't count how many times you ejaculate, but your nervous system does notice patterns. Healthy sexual behavior feels chosen, not forced. If it feels rushed, secretive, or driven by guilt, that emotional stress can show up physically over time. There's also a common myth I want to interrupt right here. Masturbating daily does not deplete testosterone in a harmful way. Testosterone fluctuates naturally throughout the day. Short-term changes after ejaculation normalize quickly. Long-term testosterone levels are influenced far more by sleep, muscle mass, insulin resistance, and chronic stress. Let me ask you another quick question. Just think about it for yourself. Are you more tired from sexual activity or from staying up late, staring at screens, and not moving your body? Most of the time, the answer is clear once we're honest. From a prostate standpoint, hydration, regular movement, and avoiding prolonged sitting matter more than ejaculation frequency. Sitting compresses the pelvic region and reduces blood flow. Daily walking, stretching, and standing breaks do more for your prostate than abstaining out of fear. Now I want to bring this into the third and final part, where wisdom really lives. How to masturbate, or not, in a way that actually supports long-term prostate health and overall well-being. First, pay attention to how your body feels afterward. Healthy sexual release should leave you calm, not drained or irritable. If you feel discomfort in the perineum, lower back, or pelvis, slow down and check your posture and muscle tension. Many men unknowingly clench their pelvic floor. Second, separate masturbation from shame. Shame activates stress pathways that increase inflammation throughout the body. I've seen men improve urinary symptoms simply by letting go of fear around normal sexual function. The prostate responds better in a relaxed body. Third, remember that frequency is personal. For some men, daily ejaculation feels natural and supportive. For others, every few days feels better. There is no medical rule that says every day is good or every day is bad. Your body's feedback matters more than online opinions. If you have conditions like chronic prostatitis, pelvic pain syndrome, or urinary symptoms, moderation may be helpful during flare-ups. Not because masturbation is harmful, but because irritated tissue sometimes needs calm, not stimulation. This is about timing, not punishment. I also want to say this clearly. Masturbation does not replace medical screening. Regular prostate checkups, PSA discussions when appropriate, and honest conversations with your doctor are still essential. Ejaculation is one small piece of a much larger health picture. Here's a powerful mindset shift I want you to take with you. Your prostate is not fragile, and your sexuality is not dangerous. Your body is designed with resilience. When you support it with sleep, movement, hydration, emotional balance, and informed choices, it responds remarkably well. So if you've been carrying fear about masturbating every day, I hope this conversation has eased some of that weight. Knowledge replaces anxiety, and calm supports healing. That alone can make a difference you feel. If this helped you see your prostate health more clearly, take a moment to reflect on your own habits, not with judgment, but with curiosity. And if you feel comfortable, share your thoughts or questions in the comments below. You're not alone in asking them, even if it sometimes feels that way.